Welcome back to Newsmaker Live. I'm Clinton Reynolds. Thank you very much for tuning into the program. We're discussing health this evening, specifically diabetes and hypertension. And we're not going down the beaten path tonight. We're talking about the commonness of diabetes and also the cost. This is an area that is often overlooked. But tonight we want to bring it to prominence, and we are discussing it with Perseus Prosper. He's the PRO of the Renal Association, and Lydia Atkins, the chairperson of the Education and Outreach Committee of the Diabetes and Hypertension Association. Now, before I went to break, I brought up this scenario where two ministries operating in the same government sign an MOU to work together for the good of youth, Ministry of Sports and Ministry of Education. And I'm sure that this is not something that is unique to those ministries, where you have policies being developed in isolation or policies being developed in more or less of a vacuum. So education takes care of its business, sports takes care of its business, health takes care of its business, but there are no there's no collaboration. There are synergies that can be identified and created, but they're not explored. How is the Ministry of Health working on that issue to ensure that the message reaches the right people, that they're not working on their own? You know, education is involved when we start in, you know, with the children in school. The Ministry of Sports, Youth and Sports is involved when we talk about our youth and protecting their health and their lives from the time they're young. How can we make that work better?
The Ministry of Health is of the view that all policy is health policy. So policies, as I mentioned, on food export bills, policies on community development, policies on education, they all impact health, because the decisions, person's behavior when it comes to health are determined by other factors and not just health issues, but those things happen within the context of socio-political and economical factors. And so they've embraced the concept of all policy being health policy, and they continue to work with other ministries. For example, the nutrition unit would be working with the Ministry of Education when we look at the school feeding program, right. The dental unit working with education when we look at getting dental services out to children in schools. And so we continue to embrace an approach, and this would be a new approach for us, which would be guided by a national policy on health that directs where it is that we would go when we look at population health.
So where is the national policy at present? Can you answer that question?
No, I'm not able to comment on that question at the moment.
But it's been developed. It's something that we're working towards, because right now it does not exist.
Yes, it is. It's something that we are working towards. It's something that we recognize an urgent need for. And it's something that indicates that we are serious as to population health, as to the health of St. Lucians.
Mm-hmm. Now, renal health and diabetes, I raised that question earlier on. The relation between them. You are the PRO of the Renal Association, but you're also part of the Diabetes Association. It might seem like a double whammy for you, but what is the relationship between the two, you know, renal failure and also diabetes?
Well, here, worldwide, hypertension and diabetes is the major causes of renal failure. Here in St. Lucia, hypertension, then diabetes. But on the worldwide scale, it's diabetes, then hypertension. But here in St. Lucia, it's diabetes, then hypertension. So being part of
hypertension, then diabetes.
Then diabetes, sorry, okay. Yeah. Right. So being part of it goes hand in hand. If you don't control diabetes, you get renal failure. Mm-hmm. So that right now we need to work as the association, Renal Association needs to be in hand with the Diabetes Association to spread that awareness, bring that awareness to the public that uncontrolled diabetes or hypertension could lead to renal failure.
Now we talk a lot about diabetes and hypertension. Let's break it down. Let's to its basic elements. For people who hear about diabetes, who hear about hypertension, from a medical standpoint, what really are the two? And what is the difference between the two?
I am not able to speak from a medical standpoint because I am not a health practitioner. I'm not a physician. And so I try to ensure that I don't speak for a physician. I don't speak for a clinical person. Diabetes, in the simplest terms, is the uncontrolled blood sugar. Hypertension, again, in the very simple breakdown of it, is uncontrolled blood pressure. Those diseases seem to walk hand in hand, and as Perseus indicated, currently, even as we speak in St. Lucia, 96% of the persons on dialysis for renal failure are as a consequence of diabetes and hypertension. At least 40 to 44% of that is as a consequence of diabetes, and 56% as a consequence of high blood pressure. Well, I think I got my math wrong. So 56 and 40.
But we understand, you know, it adds up, and the numbers are pretty close to what you say.
What is important for us is that the risk factors for diabetes are the same risk factors for high blood pressure, are the same risk factors for chronic diseases like cancers. And so it is physical inactivity, improper diet, alcohol consumption, and when we say alcohol consumption, we mean not consuming alcohol immoderately, and tobacco use. The World Bank, in a study that they did last year, identified that the data indicated that St. Lucia has the highest consumption of alcohol per capita in the OECS countries, and that figure is even higher among the poorer households for St. Lucia. When we look at inactivity and diet, it's projected that 60% of St. Lucian women would be obese by 2015. And those figures are important because there are implications in terms of where are we going to, where is our population health going to, what will health in St. Lucia look like in the next 10, 15 years.
And I mean, part of that study as well, very alarming, that our youth, our young people who should not be drinking, there's a highest incidence of alcohol use and abuse among our youth.
Yes.
In the entire world, I think it was, or in the entire Caribbean region. I can't remember exactly what the study said, but it was still alarming that St. Lucian youth use the most alcohol per capita.
They were looking at it from the OECS perspective, and they're noticing that persons are beginning to consume alcohol and use tobacco at an early age.
Well, I think it was wider than the OECS, because I remember seeing Trinidad as well in there, you know, the party capital of the world, you would think.
Yes.
And St. Lucia was way above Trinidad, you know. St. Lucia was at 80-something%. And when I looked at that report, I was like, wow, that is significant. I mean, and the question, you know, has to be raised again. What are we doing? You know, what are we doing? What are our policies regarding those issues? You know, because we see the youth in the boulevard every Friday, you know, with their little cups in their hands, and they're walking around, and, you know, it's a status symbol now, you know, to have a little plastic cup in your hand with alcohol walking around the place. And you have school children who are congregating around the same area, and the influences are passed on, because you're modeling, the children are modeling what they see in society, what seems to be cool in society. And when they get to that point, or even before they get to that point, they want to follow, you know. Yet our authorities do very little.
Going back at I remember when I was diagnosed 22 years ago, I probably could have counted on probably 3 patients, juvenile diabetes. And alarmingly, we had our second youth diabetic camp, and the numbers are, we almost had like 19 young individuals at that youth camp. You know, I was just like, wow. Back then when I was diagnosed, it was 3, and now it's like we had 19 already. So it's alarming, you know.
Yeah, and that's why any approach that we take when it comes to addressing diabetes and hypertension must be multi-pronged. It can't be just education. It can't be just we advocating for behavioral change, but those things need to take place within the context of policy.
Now, we want to talk about the cost, and you know, we said that we'll focus on that. We're due to take a break very soon, but we can introduce that aspect of it, the cost of diabetes, you know. It's not only something that affects your life, changes your way of life, but there's also a cost related to it, which is significant. Tell us about that, you know.
Yeah, looking at it from a regional perspective first, in terms of Latin America and the Caribbean islands, we have globally the highest burden in terms of cost, where we spend at least 65 million US dollars annually on diabetes related costs. That does not even begin to take into account the amount of spending that we do for hypertension, and we believe that the incidence of hypertension to be higher than that of diabetes, and the related comorbidities are just as expensive. Yet we were saying that we spend as much as $65 million annually, which represents at least 2 to 4% of GDP for countries within the Latin American and Caribbean islands. One of the other things that we can comment on is that, for example, when we look at government spending for dialysis, where we spend on average 1.2 million US dollars per year for dialysis.
And those figures are for the entire Caribbean region.
That
that
particular $1.2 million figure is in relation with regard to St. Lucia.
Just St. Lucia.
Yes, and we're spending at least 3% of our annual healthcare budget to treat 0.001% of our population, which is a very small part of our population, yet they consume, if we're looking at it proportionately, a significant part of our health budget. We can't forego that cost. We can't say that we're going to stop it. What we need to begin to address is the rate at which persons enter dialysis, the rate at which persons need dialysis or have to access care for dialysis.
Now, talking about dialysis, there are very many challenges with dialysis, because right now we don't have enough units to treat the number of people who require dialysis. I mean, you have been on dialysis for a while now, and you're one of the fortunate ones who has an appointment, you know, every week. I want you to talk a little bit about that after the break. You're watching Newsmaker Live. We're discussing diabetes and hypertension, the cost of it, and how common it is in our society. Stay with us. We'll take a break. When we come back, we'll discuss that issue, and also we'll be getting ready to take your calls. Stay with us.